I am Dr. N.K. Venkataramana, neurosurgeon, Brains Super Specialty Hospital. Spine is a very important part of the body, which is the backbone of all of us, because of which we are able to stand up, carry out different activities of the day. It gives mobility as well as stability. Now, in the bargain, spine always will have many problems, and like any other bone and the joint, spine also has joints and also the bones and the ligaments which undergo age related changes. Like knee joints, the joints in the spine also undergo changes. That is what we call as spondylosis. Otherwise also, in the spine we have three areas. One is the neck, it is called cervical spine. The other one is called thoracic spine, which is the middle part. The third one, the commonest, is the lumbar spine, is the lower part, which we call also as the waist. In the entire spine, if you look at, the most mobile part is the neck and the lumbar spine. Now, because of that, we are able to turn the neck, we are able to bend backwards and forwards, and we are able to look around in different directions. So, the bones are also designed and made in such a alignment so that all these movements are possible in our day-to-day activities as well as for special skilled activities such as dance, acrobatics, circus, and so many things we are able to do today. Now, while doing this, one of the commonest problem is the neck pain. Pain can happen because of the various reasons, either because of the bony problem, or it could be a problem in the ligaments or weakness, a problem in the joints, and between the two bones there is something called as a disc. It is like a washer, and this disc is the one is a flexible and soft structure and will make the bone flexible, and the ligaments are the ones which will control the range of movement. When the ligaments become weak, the range goes beyond the limit, stretching the area, causing the inadvertent damage. And behind all these structures, the most important things is called the nerve roots, and the brain communicates to the body through the nerve roots which comes through the spinal cord, and all these nerve roots come out between the two bones at every level and comes to each of these muscles in the hands as well as in the legs. So, all the nerves that come to the body come through the neck. So, it is very important that you take care of the neck and maintain it all through the life. Now, whenever there is a pain in the neck, that means either there is an abnormal movement of the joint, or a defect in the joint, or a dislocation in the joint, or a deformity from birth, or as there is a damage to the disc. Any of these things can cause pain apart from injuries to any of these structures. That includes the bone, ligament, muscle, disc, and whenever this abnormal movement extends beyond its original range and touches the nerve or impinges the nerve, then it produces a shooting pain that can come down to the hand. So, we call this as a radicular pain. Now, whenever there is a neck pain, what we need to look at is that, is it because of the movement, is it because of the injury, is it because of any other inflammatory disease, or is it because of any of the tumor, or the most commonest is the damage to the disc. The disc is a structure which is a very flexible structure because it contains a jelly inside and an outer ring, and whenever we are moving and the jelly keeps floating inside in such a way that it makes the every neck movement possible to the extent we want, and whenever it becomes hard, that movement starts getting restricted, and at a time when it cracks and the jelly will come out and touches the root, and that is the time you get severe pain coming down to the hand. This can happen with any kind of dehydration or inflammation or injury or sports injury, unusual exercise or acrobatics. So, some of these things have to be gradually trained, and regular exercise can build the muscles as a support so that the disc can be maintained. When disc is damaged, and then that need to be repaired, fortunately today the artificial disc is available, so that whatever disc is damaged we can remove and replace that with an artificial disc, so that one gets a full height, movement, range of movement, and flexibility of the neck.